filming situation. I'm trying to get some things done in my room. I don't have spotlights anymore. Get rid of the cubby, but that's all for a different video. um, so I have a little bit of time before I go to a doctor's appointment, my asthma doctor, and I thought I would just kind of give an update to that whole story. So after the Nucala, I kind of didn't go see him for a while, and then he put me on a medication called Xylutin. Um, Now this medication, when he was talking to me about it, I asked him, does it have any sulfa properties? Meaning like anything that's in sulfa drugs is, does not appear at all. So it should be fine. Now I'm allergic to sulfa drugs. I can't remember why I needed to take it in the past, but I did, and I broke out in hives. So I'm allergic to sulfa, so I'm now super, super aware of anything with sulfa. And so, I took his word for it. I should. You'd think by now I would learn not to take his word on anything like that. So, and for this medication, I had to do what I know it as. It's called a vancomycin with my grandma because she's on vancomycin so often. What they do is, they before you start the medication, they draw your blood, make sure that your kidneys are good, and then a month into your medication, a month into the medication, they take it again to check your kidney levels. 2 months, however long you're going to be on it. So I went and I did the blood test for them, started the medication, and about a week into it, I started effects. Nausea, diarrhea, loss of appetite, upset stomach. And so I looked it up, and the medication was working. It was supposed to work the same as prednisone, just being steroid free. So I decided to take the good with the bad. The medication was working, and along down the line of after a month of taking it, I started to get more side effects. Stuffy nose, but at the time I wrote it off as just being allergies. One of the side effects was muscle weakness, and I started to have a lot of problems with my knee. Uh, and so I again decided to write this off as, maybe it's just my knee, whatever. When I went to see the doctor about it, he said if it continues to happen, it might be gout. And it's continued to happen pretty much every day since I saw him, significant amounts of pain. But I've been kind of treating it on my own with tea and stuff like that. Again, for another video. And then another thing was that one morning I woke up, my grandma and I were just watching TV, but she kept looking at me and just looking at me every once in a while. I'm like, okay, that's a little weird. And she said, your face looks really, really swollen and red. Now, I have rosacea, so I get like redness here and sometimes here. I don't think I'm in any of my videos. I don't wear makeup in my videos, so I don't know if you guys have ever seen it or not. But I do have rosacea, so once in a while it does flare up, and I'll, like I said, get redness here. And my teeth, of course it itches. It's okay, it's just my rosacea, and I blew it off. And then she was okay, but your face looks, really swollen. As you can see, I have kind of like an oval face. Well, when I got up to go to the bathroom and I was washing my hands, I looked in the mirror. My face was a literal ball. So I right away decided to look at the side effects again, and I remembered everything. The thing with my face, all of that. Loss of appetite, upset stomach, nausea. Vomiting was one of them, but thank God I didn't get vomiting. So right then and there, I decided to call them, and I'm like, you know what? If it were only a few things, I'd be able to deal with it. But being that it was all of this, and I kind of broke out in hives on my face, even after I asked him if there were sulfur properties to it, it just, I didn't want to be on the medication anymore if it was going to be doing all that to me. And so they took me off the medication, and then I'm in this program through school, And I went for my exam before I could get the glasses, and they found cataracts at the back of my eyes. Now, I know that they could have started forming from the prednisone because that is one of the, one of the side effects, one of the things that could happen, one of the risks that that can happen when you take prednisone for so long is that you can get cataracts. But being that my vision started to get horrible right after I started the Nucala, I definitely think that the cataracts are due in part to the Nucala as well. And he can say as much as he wants that it's not from anything that he's prescribed me or anything like that. I know it is. So much so that at this point, I've thought about seeking legal help for medical malpractice because he's basically treating me like a test buddy when you think about it. I was the first one in his office to get Nucala, even after I went to him with all these side effects, with my psoriasis and stuff like that. Oh, speaking of which, it's doing fairly well. You can kind of see that one. There's that one on my finger. You can kind of see this one too. But the ones like there, can't really see them. You can see them, but you can't. There's actually a big, huge, like paint splotch one on that arm. But it has. They had. I have my moments where they look good and they look bad. As you guys know, I embrace that stuff. So whatever. I mean, it's gonna happen. So I embrace it. Anyways, and so with the Nucala, after I went to him with all these side effects that were happening, he still refused to take me off of it because it was a good medication and it worked. He was not listening to me at all when I was telling him my vision is horrible. I'm getting, more psoriasis than I should be. I I don't want to be on this medication anymore. He was not listening to his patient. He did not care. And then he wanted to put me on another injectable medication. Um, I told him I'm sorry, but I would just rather not. I'm not saying that all injectable medications are like that, but I would just rather not, have to go every month to be injected with something that's, gonna, make my vision worse or whatever. And so, and then this, because when we were talking about the Xylutin, um, he was being shadowed by a doctor from a free clinic. So yeah. Uh, and no matter how many, times, I would tell him, like I said, about the Nucala, he would tell me time and time again, oh, it's not the medication, it's not the medication, it's not the medication. Who was he telling that to, himself or me? I don't understand that. I mean, they basically 86'd me one time from the office when they sent me that, when my insurance sent me that note saying that I was calling to make an appointment, you know, the way that the nurses treat me, you know, like I've thought about looking for, other, doctors, but this one has just burned me so much that I would just rather stay with him and deal with him and try and figure it out myself. Because he's really not helping things at all. I'm surprised that I have not died from an asthma attack being under his care. It's just horrible, and I hope if any of you live where I live and you have this, severe asthma, I hope that you guys never, ever have to deal with a doctor like this because it's absolutely horrible. The whole medical malpractice thing, I don't know if I should pursue it or not. I really do feel like I should because Xylutin, when I was looking up the side effects at first, the first time, I learned that there was another form of it that was taken off the market in 2008. So, was Xylutin in a whole, the whole medication, all forms of it, were they all taken off the market? And he just didn't know, or he just didn't care. I don't understand that. I really don't. So, okay, so I'm gonna go. That's really the only update that I have right now. Maybe there'll be more later. So I have to go, because I have an appointment, like I said, an appointment with him at 4, and it is now almost 2. Oh, and from the whole, okay, so after he took me off the medication, I figured, okay, give me a week to detox from it. All the side effects will go away. At the time, I still had, the diarrhea was starting to go away a little bit, but I still had upset stomach, really bad gas, and stuff like that. And I got gastritis from the medication. It's nothing like, disease or anything like that. It's just something that happens once in a while. So I now have to take Gas-X once in a while. And then I was on, and I'm on 2 weeks worth of this. It's called sucralfate. And I have to take 4 of those a day. So I have to take one at 3. And that'll be my first one of the day. But it's just such an inconvenience because, okay, look at this. They don't word it on the actual label, but they word it here on the side, on one of these side labels. Okay, so it says, unless otherwise directed by your doctor, take medication on an empty stomach 1 hour prior or 2 hours after a meal. So I just ate, I just got done eating like maybe 20 minutes ago. So at 3, I'm gonna have to take a pill, and then I'll be able to eat, something like a snack or a dinner, and then 2 hours after that, I'll need to take my second pill, and then I'll be able to eat another snack at an hour after that, and then 2 hours after that, take my third pill, so on and so forth. It's such an inconvenience because I have to set this, and sometimes I'm like, okay, my brain doesn't work sometimes, and I'm like, okay, 2 hours, so do this and do that. By the time I actually get it set to 2 hours, it's already been like, 10-15 minutes into the 2 hours. It's like, oh god. So, you guys, it's just, he's the worst doctor that I've had. Really, he has been. And that says a lot because the last dentist that I went to that pulled out my last 2 wisdom teeth, they approved one, but they didn't approve the other. He said, "Well, who cares? You're gonna be 21. It's the last time you'll be able to come to see a dentist, so we're gonna do it anyways." Okay, good, cool. And he's never once. My asthma doctor has never once been like that. Never once. Um, let's see what else. That's really it. So. Hey guys, I'll see you later. Like I said, maybe there will be another update later. I'm not exactly sure. Maybe the next time I make a video, it'll be back in my room. I don't know. Like I said, it's for a whole nother video. So yeah, I'll see you guys later. Bye.